Hi, I'm Dr. Madhusudhan, Consultant Hand, Wrist and Microsurgeon at Bangalore Baptist Hospital. Today, I'll be briefing you about Carpal Tunnel Syndrome, wherein patient complains of pain, numbness and occasionally weakness of the fingers. This occurs when a nerve called median nerve gets compressed or squeezed. At the level of wrist, the median nerve passes through a small tunnel, and when the nerve gets compressed within this tunnel, it will result in what is called carpal tunnel syndrome. This nerve controls the movements of thumb, index and middle fingers, and also gives sensation to these fingers along with a part of ring finger. This condition is mostly idiopathic, which means the exact reason is unknown. However, it can be commonly seen in people who overuse their wrist, the patients with diabetes or thyroid disorders, and also during the pregnancy. Symptoms include pain, numbness or tingling sensation, or weakness of the fingers. Symptoms are most commonly in the night, and this can wake you up from the sleep. Both the hands are affected, but commonly one hand has more problem than the other. Driving, typing, or even keeping the wrist in the same position for a prolonged time can aggravate your symptoms. Mostly, the detailed clinical examination is all what we need to arrive at a diagnosis. But there are few tests like ultrasound scan and nerve conduction studies which will help to confirm the diagnosis. In nerve conduction studies, it will help us to understand how well the electric current are passing through the nerve. Carpal tunnel syndrome can be managed both surgically and non-surgically. The non-surgical methods include splint, where a small belt is applied around the wrist, usually the night splint, which means it has to be worn only during the night. This is the mainstay of treatment during pregnancy because in most cases the symptoms improve once the child is born. Medications can also be used to relieve the symptoms. Physiotherapy is another mode of treatment where a physiotherapist or occupational therapist are involved in the treatment. There is a few group of patients, those who may not respond to any of the above treatment modalities, or there might be severe damage to the nerve. These patients will require surgery. During surgery, the ligament will be released so that the nerve becomes free. And following surgery, there will be reduction in the symptoms and patient will be able to use their hand a lot better. Thank you.